While the COVID-19 pandemic has fundamentally changed the learning environment at Del Mar College, our number one priority continues to be the health and safety of our students, employees, and guests. Everyone entering our campuses is required to follow strict protocols designed to prevent the spread of COVID-19. Del Mar College adheres to guidelines established by the Centers for Disease Control and Prevention, as well as directives issued by the federal, state, and local governments. Here's what we're asking of those who visit our facilities. Prior to coming to campus, everyone is asked to take personal accountability for their health and the health of others by conducting a daily self-symptom assessment. Anyone showing symptoms of the virus who has tested positive or has had close contact with someone who has COVID-19 should not come to campus. Once on campus, everyone must practice social distancing. The CDC reports that limiting face-to-face contact with others is the best way to reduce the spread of COVID-19. This means keeping a space of at least 6 feet between yourself and other people, or about 2 arms length. We also ask that you limit using elevators, walkways, and hallways as much as possible, and be sure to use marked entrances and exits. Secondly, wearing a face covering is required on our campuses. This can be a face mask or a cloth covering. According to the CDC, cloth face coverings can slow the spread of COVID-19 and prevent people who may have the virus and not know it from transmitting it to others. If you don't have your own face covering, we will provide one. Prevention hygiene is our third major protocol. We ask that everyone wash their hands frequently and use alcohol-based sanitizer when soap and water are not available. Avoid touching your face, eyes, or nose, and please cover your mouth when coughing or sneezing. Finally, it's important to limit gatherings and meetings while on campus. Meeting remotely should be a first option. If that's not possible, limit the number of participants in face-to-face meetings, practice social distancing, and provide a remote option for those who can't attend. These health and safety protocols can be modified at any time depending on changing conditions. Although access to our campuses is restricted, our physical facilities staff are regularly cleaning and disinfecting classrooms, offices, restrooms, hallways, and all touch points. Del Mar College will continue to take all necessary precautions as long as there is a risk of COVID-19 spread in our community. For more information on our health and safety protocols, visit us on the web at www.delmar.edu/RTC.
As businesses in Texas adopt new technologies, those technologies are, for the most part, digital in nature. They are wireless networking, and as a result, businesses are going to have an even broader need, because along with that convenience comes a huge responsibility. If I'm going to take somebody's digital data, how can I be sure that I am securing their payment information? Every day there's another, breach. In January of last year, I tell people I was approached by the FBI in the best possible way one can be approached by the FBI, meaning that they did not have their guns drawn. I was asked to head up a public-private partnership that the FBI has had for the last 20 years called InfraGard. Special Agent Angela Hahn with the FBI in Houston is the liaison, and it was very, very thoughtful of her. She wanted to recognize my effort and nominated me for the FBI's Rookie of the Year, which I was, in fact, awarded. That's just a huge honor to be recognized for our effort down here, for my role in not just teaching in the classroom, not just representing the college locally when I'm on the various news channels, but regionally and nationally.
Here's how you can retrieve your Del Mar College student ID, username, email, and password. Step 1. Go to delmar.edu and click the drop-down menu if you're on mobile, and click WebDMC. If you're on a desktop or laptop, you can find the WebDMC link at the top of the page. Step 2. Click the Don't Have a Student ID or Username, Get Them Here link on the left of the page. Step 3. You'll see 2 fields that you'll have to fill out: student ID and date of birth. For the student ID portion, if you don't have one, put in your social security number. Step 4. Enter your date of birth in the field, and then click the Submit button. Step 5. Read through Del Mar College Computer and Network Resources Statement of Acceptable Use, and once you've read through it, click Accept. Step 6. Save the student ID, username, college email address, and the PIN on the page. Your PIN is your temporary password. Thank you for watching. Let us know what the next how-to video should be in the comments. While the COVID-19 pandemic has fundamentally changed the learning environment at Del Mar College, our number one priority continues to be the health and safety of our students, employees, and guests. Everyone entering our campuses is required to follow strict protocols designed to prevent the spread of COVID-19. Del Mar College adheres to guidelines established by the Centers for Disease Control and Prevention, as well as directives issued by the federal, state, and local governments. Here's what we're asking of those who visit our facilities. Prior to coming to campus, everyone is asked to take personal accountability for their health and the health of others by conducting a daily self-symptom assessment. Anyone showing symptoms of the virus who has tested positive or has had close contact with someone who has COVID-19 should not come to campus. Once on campus, everyone must practice social distancing. The CDC reports that limiting face-to-face contact with others is the best way to reduce the spread of COVID-19. This means keeping a space of at least 6 feet between yourself and other people, or about 2 arms length. We also ask that you limit using elevators, walkways, and hallways as much as possible, and be sure to use marked entrances and exits. Secondly, wearing a face covering is required on our campuses. This can be a face mask or a cloth covering. According to the CDC, cloth face coverings can slow the spread of COVID-19 and prevent people who may have the virus and not know it from transmitting it to others. If you don't have your own face covering, we will provide one. Prevention hygiene is our third major protocol. We ask that everyone wash their hands frequently and use alcohol-based sanitizer when soap and water are not available. Avoid touching your face, eyes, or nose, and please cover your mouth when coughing or sneezing. Finally, it's important to limit gatherings and meetings while on campus. Meeting remotely should be a first option. If that's not possible, limit the number of participants in face-to-face meetings, practice social distancing, and provide a remote option for those who can't attend. These health and safety protocols can be modified at any time depending on changing conditions. Although access to our campuses is restricted, our physical facilities staff are regularly cleaning and disinfecting classrooms, offices, restrooms, hallways, and all touch points. Del Mar
You're up.
Greetings, Vikings. Thank you for joining us today for this live presentation. On behalf of the Department of Nurse Education at Del Mar College, I welcome you to our presentation regarding our upcoming August 31st deadline date for our LVN and RN program. I am Belinda Munoz. I'm the advisor for the Nurse Education Department. I've been with the college about a year and a half now. And so my role is to advise you as you're taking your prerequisites and going through the process of trying to be ready to apply to the program, which is the step that you are at today. Joining me is Christy Pettis, one of my colleagues, and she will do a brief introduction as well. Christy?
Hello, I'm Christy Pettis. I've been with the Department of Nurse Education for 4.5 years now. My position with the department is strictly student records admission requirements. I review applications, I handle all paperwork in the department, and I make sure that you will be ready to go if you're accepted to the nursing program. Since I do all the application process, I'm here to help answer any questions you may have regarding the application.
Okay, so we'll go on ahead and get started with our presentation. We have quite a bit of information that we would like to share with you today. As I mentioned a moment ago, this presentation is specifically geared for all of you students that are trying to make our August 31st deadline date for the LVN and RN program that will be starting the spring 2021 semester, which is in January. Our application is actually July 31st, but obviously with the current pandemic in our community and the way it's affected our operations, mostly like TEAS testing operations and such at Del Mar College, we were able to extend our deadline to August 31st. So you may remember we did a presentation last month, which is more of a general presentation of how do I prepare to apply to the program, what classes do I need to take, those kinds of things. This session is specifically geared for those of you that will be submitting an application hopefully next month. So we are a little bit about ourselves. We are an accredited program through ASIN, and we do have scholarly prepared and skilled faculty that provide you both a clinical and a classroom learning experience. We do have a very competitive admissions process as we are seeking to prepare the most highly qualified and skilled nurses for our community. And once you are admitted into the program, we are actually located over at the West Campus, which is on Old Brownsville Road and Airport Road. So that will be a little bit of a change for some of you that have been, with us during this time, working on your prerequisites. You were probably taking them over at the East Campus or maybe even out at our Northwest location, but we are located on the West Campus. So who is eligible to apply for the August 31 deadline date? Those are the students that are trying to seek admission into our vocational nursing program and our registered nursing program. Keep in mind our vocational nursing program is a certificate program and our RN program is an Associate of Applied Science. Now, the classes that you have to have in your background to be able to apply are what we refer to as prerequisites and co-requisites. You'll see here on your screen the listing of the courses. The courses that are in red, the prerequisites, the English, psychology, anatomy and physiology 1 and 2 are must-haves. You absolutely must have completed these 4 classes to be eligible to apply, and you must have completed them with a C or better. So for instance, for this upcoming August 31 deadline date, you must have these 4 classes already completed with a C or better by the end of summer session 2. So for instance, let's say you had a D in one of the classes, like psychology. Let's say you had a D, or I'm sorry, let's say English. Let's say you had a D and you were repeating it. You must have a C or better by the end of summer session 2. Now the classes that are the co-requisites, your speech class, your philosophy class, which we're mostly looking for intro to ethics, chemistry and microbiology. It is ideal for you to have all 8, if possible, by the time that you apply. In having all 8, they will all factor into your program GPA calculation. Now, we do have students that will have 6 of them, 7 of them at the moment that they apply, but because we have a semester in between the time that you apply and the time the program starts, you could essentially complete all 8 by the time that you would start the program if you're admitted. But like I said, keep in mind that the more that you have of the 8 total, the more that we will be using in your GPA calculation. Now, off of the Associate of Arts degree, if you're familiar with your degree plan, the code is usually ERGN. Out of those, we have selected the 8 classes that we consider prerequisites and co-requisites. The other courses on that degree plan, such as the histories, governments, creative arts, and such, any of those courses that are on the degree plan that are not part of those 8 can definitely help you have a stronger application when you apply, because those classes count as bonus points. Some of them are worth 1 point, some of them are worth 2 points. I encourage you to refer to our program guidelines on our website, as all of that is spelled out towards the back end, like page 7 and 8 or so of the guidelines. We list all of that out and itemize which ones are worth 1 or 2 points. Now, as far as admission requirements, if you are a Del Mar student, you obviously are complete with your enrollment process. We do have students that are applying to our program that have not been with us during this time. Perhaps they're coming from another college or university. Keep in mind that you do have to submit a Del Mar college application and declare nursing as your major, and that is to exist within the college. To apply to the nursing program, you also have to submit a separate third-party application on this website, nursingcast.org. Like I said, that is a third party that we use. So make sure that you have, like I said, an application with Del Mar if you're not one of our students, but that you submit your Nursing Cast application by August 31st. As I mentioned a while ago, we do require a C or better in all of our prerequisite and co-requisite courses. Once we average those together, we call that a program GPA. So the cool thing here is a lot of times students, will tell me, Belinda, when I first started off in college, I wasn't taking things too seriously. My GPA is not the greatest. So on the positive end of that, when we calculate your program GPA, we are calculating our prerequisite and co-requisite requirements. And that's why I was saying the more that you have of that 8 total, the better it will work out for you, because you have more grades to input into the calculator, and you have more points that you're earning. So we do require a 2.5 program GPA, which is those 8 classes, no exceptions. Okay, we do not round, we do not make exceptions. So unfortunately, if you're at a 2.48, you would not be eligible to apply. Now, you can email me and ask me to email you that program calculator. And if you need to, I can do a one-on-one advising appointment with you and kind of guide you on how to use the calculator and then how to factor in bonus points. You must pass the TEAS test. We are looking at 3 sections: your overall score, your reading score, and your science score. Up until about a year and a half ago, right around the time that I was hired at Del Mar, is when we made some changes to the CNA or CMA course requirement. About a year ago, we updated our guidelines, and that is no longer required. However, we do encourage it, and if you do have CNA or CMA certification, either with or without bonus points, you could earn possibly anywhere from 2 to 4 extra bonus points on your application. So that is a change recently where we no longer require it, but we do encourage CNA or CMA certification. We do not have an expiration date on any of our prerequisites and co-requisites. Most often we get asked about our science classes, like anatomy. I believe sometime back we used to have like a 5-year requirement or so, but we no longer have that time limitation of the grades that you earned. if you happen to have taken those classes. Let's say you took classes and went on about life, and came back to us 5 years later, and now you're interested in applying and continuing on with some of the coursework you had already taken. We will be able to use all of that. And like I said, none of the courses have expiration dates. And we do require immunizations. Again, if you refer to your program guidelines, in the middle of that document, you will see the immunizations that are required after you're admitted into the program. So really, if you're looking at the program guidelines, you want to look at pages like 1, 2, and 3. Within that, we list the immunizations that we require at the time of application. The middle of the document itemizes which ones you would have to submit if you are admitted into the program. So about the TEAS test, we are now offering the exam in addition to the testing center on campus. We do offer it online. Again, we are looking at your overall score, your reading score, and your science score. I listed the benchmarks, as we refer to them, here on this slide. The test itself is comprised of 4 sections: reading, math, science, and English and language usage. Keeping in mind that the math score factors into your overall score, but we are specifically looking at your overall reading and science. You must pass the benchmarks on the same test. So let's say you take it and you do well overall, you do well on your reading, but your science score comes in at like 42%. Then you would have to take the test over again on your second attempt. You would have to meet the benchmarks on all 3 sections. We do allow you up to 4 times in the school year to retest. You must wait 2 weeks currently to retest. Traditionally, we do ask you to wait 4 weeks in between. However, another adjustment that we have made because of the pandemic and how it's affected our testing schedule and all is we have shortened that wait time for the August 31 deadline date to a 2-week waiting period. Tutoring is available, maybe a little short on time on that, but you could always reach out to Jeannie Ferraro with the Stone Writing Center. She is available to tutor virtually, but let's say you're at a point where you just need to retest, you're retesting next week, and you just want a quick crash review on science section. You may want to reach out to her, and Jeannie is a retired school teacher and has some resources that she's able to share with you. And even though right now a lot of us are working virtually and remotely, she has resources that she can share with you, perhaps some online resources and such. So it may not be too late if you're still trying to master the TEAS test. We do now offer bonus points on the TEAS test based on your performance, and you will find those itemized in our guidelines as well. And if you have not taken the exam, you still have time, but you do have to contact our staff, DNA's Department of Nurse Education staff, to register for the exam. So you will have to contact our office and get registered and go through the process of registration and preparation for your exam. Okay, getting into NursingCast. Like I mentioned a while ago, that is a third-party application that we use. And so you will go on to nursingcast.org to create your account. Keep in mind that this application cycle is for the LVN and RN program. You can only submit one application, for one program. There have been times that students have submitted 2 applications, and you don't want to do that. I believe the initial fee is in the range of $50. If you submit a second application, it'll cost you, I think, somewhere around $35. So you really don't want to do that because you'll be wasting money. We will only accept one application. If you happen to do that, Christy will be giving you a call and asking you which program do you want to submit your application to. So just save yourself that money, decide which route you want to go. The application cycle is open for both programs, but you can only submit one application. You will create your account, make sure that you read and follow all instructions using the Help Center and the tutorials and such. Nursing CAS has a lot of help available, so we encourage you to reach out to them. They design the application with the information that we are asking from them, but we are not like their support center. Okay, so we highly encourage you to reach out to them. If you have questions regarding admissions or your GPA, those kinds of things, those are the questions you can direct to me. But any other questions technically about nursing CAS are better directed to them directly. Some of the tips that we'd like to share with you, some of things that we see that go well on applications, and maybe some pitfalls, some things that you want to avoid, are some things that we wanted to highlight with you on this presentation. I cannot emphasize enough to read and follow all instructions. There have been times that students had all the credentials to apply, but simply because they didn't present it in the manner that it was supposed to be on the application, it cost them their application not being reviewed. And we certainly don't want that to happen to you, especially after all the time that you've spent taking the coursework. So make sure that you are reading all of the instructions. When you the first section is, you know, your biographical information, pretty straightforward information about yourself, name and address, those kinds of basic questions. When you get to the second section, make sure that you're reading the instructions on how they want you to enter your information. You must enter every college and university that you've attended. You must enter every course you've ever taken, even if you were a major aside from nurse education. Let's say you were a business major. You would still list all of the classes that you took while you were enrolled at that particular school in that semester, whether they pertain to the nursing program or not. So you must list all courses that you've taken in order by semester, by college, by university, and you must list the grade earned, or if you withdrew, whatever the coding is for that school. Some schools you'll just do a plain W. We know that's withdrew. Some of them will have a WP or WF, withdrew passing, withdrew failing. However, it is entered on your transcript. Okay, so you want to get an official copy of your transcript for yourself so that as you sit there and you are inputting the information, you are taking it directly off of your transcript. You also will have to send your transcripts to Nursing CAS from all colleges and universities you've attended. And that includes all of your Del Mar records, or I'm sorry, your one Del Mar transcript, but that does include your Del Mar transcript. Keep in mind, Nursing CAS is a third-party application, so they do not have access to your Del Mar records. That's a common mistake we see in the process where students will say, well, I thought, y'all would pull my records since I'm a student here. Remember, Nursing CAS is a third-party application, so they will not have your Del Mar records. And our admissions, through our admissions process, we will not go in there and pull your Del Mar records. So make sure that you send all transcripts from every college and university you've attended, including Del Mar. Now, if you are enrolled over the summertime, if you only enrolled summer session 1, you can request your transcript now. If you are enrolled through summer session 2, you do have plenty of time to wait for the semester to end, wait for your grades to post, so you can request your transcript, but ask them to not forward that to Nursing CAS until your final grades are posted on your Del Mar transcript. If you're working on your application now and you list your classes as in progress, and you wait until the semester ends, and you can go back into Nursing CAS and put in your final grades. So you want to make sure that all of your information is correct before you submit your application. On the third category, I believe it's called the supporting information. It's asking you to list, I think, like awards, honors, achievements, licenses and certifications and such. At Del Mar, we do not consider the information in that section. So you can go through on those 3 sections and you can answer that question as I'm not adding any. Okay, now that is because we are strictly going by the 8 prerequisites and co-requisites, C or better, your program GPA, which is 2.5 or higher, your TEAS exam results. So we are not taking work experience into account for these two programs, awards, honors. And of course, those are wonderful to have if you're like employee of the month and such, but we just don't consider any kind of that information on the admissions process. So once again, under that supporting information for those three areas there, you can say, I am not adding any. But if you do have, let's say, CNA or CNA certification, and you're wanting that to be included for bonus points, then that would be in the fourth section, the final section of your nursing CAS application, which is the program materials section. That's pretty much where everything else will go. Your immunization records, any certifications like CNA, CMA, and such. Okay, so the bulk of it, is all in how you submit and present your information. We cannot stress enough for you all to read the instructions and be certain how you're presenting your information. Now, how do we select the class? Most importantly, so I keep talking about your admission points and bonus points. And as I mentioned earlier, if you have not already attended another group advising session or individual advising session with me and had me email you that calculator, please send me an email today and I can send that your way. If you need additional help trying to figure out where you stand, set up an appointment with me one-on-one and I can certainly help you through that. So we will calculate your program GPA and add any bonus points, which includes coursework such as the pathway points, TEAS test bonus points, CNA or CMA certification bonus points. All of that gets factored in. So once we have your program GPA in addition to bonus points, we will calculate your final point number, and then we will rank you all from highest to lowest based on your total amount of points, okay, your total program points. So there is no, a lot of times we get asked, well, what's the range I should be in? There is no right or wrong answer to that because it just depends how many applications we receive and how those points line up for everyone. But we do rank y'all highest to lowest. We are accepting in the neighborhood of about 100 students every semester. Okay, so again, please refer to our program guidelines. That's under the admission requirements section of our website, which is delmar.edu/RN. Okay, so again, if you don't have the calculator and you want to be certain that you meet the requirements, please reach out to me and I can certainly send that your way. August 31st is the deadline date. Certainly start that process now so that you're not in a rush and submitting that. I would not wait until August 31st. That's just me. Maybe submit it a day or two beforehand. You never know with technology and internet service, the systems can go down and such. We are now in hurricane season. I mean, it's just not a good idea to wait until the absolute last day. Of course, you can apply until the very last day, but you may want to be a day or two ahead of that. I think that covers the highlights. I know I feel like I tend to talk kind of fast. And I'm really trying to do this within our allotted time. But if anybody out there has questions, feel free to send them our way. We do have a few minutes. I think we have about 6 minutes or so left.
This is Christy again. You can't see me, but I'm here. There have been some questions, and I'm going to go ahead and go through questions now. First question we had was, what's the average amount of points that people have when they get accepted? That's a hard question to answer because students get accepted anywhere between 20 points and almost 50 points. It all depends on the applicant pool when you apply to the program. If we have a lot of students who have most of their co-recs completed, we'll have a higher point total, so the cutoff line for who gets accepted could be in the 30s. If we have a lot of students who still have some courses to take, then our cutoff line might be in the 20s. So there's not really an average amount of points that we can give you. Can we take the teas at home because of COVID? Yes, you can. Get on our website. You can get onto our ATITs page. There'll be phone numbers on there for you to call. Our TEAS coordinators will be happy to give you the information about how you can take it at home. You can be proctored at home. You do have to meet certain technical requirements, including you need a webcam and a microphone. Do you need high scores in TEAS to be accepted? No. Once you take the TEAS and you pass the TEAS, we highly recommend you stop. The reason for that is if you take it again, then you score lower, then you've just knocked yourself out of eligibility. If you do score high on the TEAS, like Belinda said, you can get bonus points, but the TEAS, you pass it, take those scores and apply. How many people are accepted to the RN program? Between RN and LVN combined, we will accept approximately 100 students. 5% of that is reserved for LVNs. So we usually have an applicant pool of about 95 RNs and 5 LVNs. How long are the TEAS scores valid? They are valid for 18 months. And that's another reason, as soon as you're eligible for the TEAS, we really recommend that go ahead and take it if you feel confident. That way, once you're finishing up maybe your prerequisites, you don't have to worry about that. So yes, they're valid for 18 months. Yes, they expire after that 18-month time frame. What is the minimum TEAS score requirement? It is exactly the same as the RN program. TEAS is required for any program that you're going to be applying for. A student who meets the minimum requirements can apply to whichever program. So requirements for LVN entry is the same as RN.
And I may have failed to mention the difference between coursework in applying to the LVN and the RN program is chemistry and microbiology. I don't remember if I verbally said it. I know it's on the slide, but LVN program requires 6, 8 are required for RN, the difference being chemistry and micro.
All right, we have another question. What's the time before we know if we are accepted or not? Once your application is submitted, we do notifications via email, your NursingCast email, within 6 weeks of the application deadline date. So with this one, the application is due August 31st. You will know by mid-October. Most likely you will know by the end of September. If you get accepted, do you start in-person clinicals right away? And if we do, are they during the day, and do you have evening clinicals as well? Okay. Yes, every level has clinicals. Level 1 does not go to clinicals until 4 weeks in, because they have to you have to learn some skills before you actually go to clinicals off-site. Right now, we have clinicals during the day only. We have had evening clinicals before. It completely depends on our medical facilities. They let us know how many students we can send to a specific facility, and they also let us know what time frames that they will accept. Typically, our clinicals are for level 1, they go from 6:45 a.m. to 4:45. Same for level 2 and level 3 and 4 are in the 6:45 to 6:45 time frame, 12-hour day. I think we're about running up out of our time for today. We really appreciate everybody joining us. I know Belinda has her email address on here. If there's any question you have whatsoever, please send them to Ms. Munoz. And then if it's something that I can help you with, she will then forward those to me, and I will be the one who will then respond. We work really closely behind the scenes. We are still moving forward even with COVID. It is not keeping us from selecting our spring class, or for anything for that matter. We have got a great staff, and we have got wonderful faculty and leadership with Dr. DeLeon and Dr. McWaugh, where we are making sure our nurses are educated even during this trying time of COVID. So thank you so much, and we really appreciate you joining us today.
Change the learning environment at Del Mar College. Our number one priority continues
for the department. I know this is an exciting time for you. This is a fun time for me as well to work with you to make sure that you're packaging your application correctly, and we don't want to see you make some common mistakes and not have your application reviewed. You've certainly worked hard to get to this point. We are here to help you make your application deadline date. As you can see, I'm in my kitchen. We are working remotely, and I am available to you. Send me an email if we need to schedule an appointment. I can certainly take a look at my calendar, the office staff, scheduling just regular advising registration appointments for the fall. But I am available by phone and email if we need to schedule a one-on-one meeting. Please reach out to me. I'm here to help you. And again, on behalf of the Department of Nurse Education, thank you for joining us today, and we look forward to receiving and reviewing your application. Good luck, everybody. Bye.
Bye. This is Christy again, really quick. We do have one last minute question. Admission requirements. Are the admission requirements different for LVN? No, they are not. You still have to have the 4 prereqs. You have to meet the same GPA. You have to pass the T's. As Belinda said, the only difference is for the co-requisites, the LVN program does not require chemistry and microbiology. You only have to have the 4 prereq plus ethics and speech. But on the front end, everything is exactly the same for both programs. Again, thank you for joining us, and please reach out if you have any further questions. Have a great day.
While the COVID-19 pandemic has fundamentally changed the learning environment at Del Mar College, our number one priority continues to be the health and safety of our students, employees, and guests. Everyone entering our campuses is required to follow strict protocols designed to prevent the spread of COVID-19. Del Mar College adheres to guidelines established by the Centers for Disease Control and Prevention, as well as directives issued by the federal, state, and local governments. Here's what we're asking of those who visit our facilities. Prior to coming to campus, everyone is asked to take personal accountability for their health and the health of others by conducting a daily self-symptom assessment. Anyone showing symptoms of the virus who has tested positive or has had close contact with someone who has COVID-19 should not come to campus. Once on campus, everyone must practice social distancing. The CDC reports that limiting face-to-face contact with others is the best way to reduce the spread of COVID-19. This means keeping a space of at least 6 feet between yourself and other people, or about 2 arms length. We also ask that you limit using elevators, walkways, and hallways